Welcome to A Window on SAHMRI, where we take you inside South Australia's independent not-for-profit health and medical research institute. Each episode, we get to know the people driving our life-changing research, getting into what motivates them personally and how their work is delivering a brighter, healthier future for all.
Caroline, tell me about the path that you've been on to be where you are now.
Okay, so I went to uni wanting to be a lawyer, but back then you couldn't get straight in. And so I went in and did an arts degree majoring in psychology. And I worked out at uni that you probably have to work a lot harder than you have to work at school to get really high grades. And so I didn't get high enough grades to get into law. So I pursued psychology, which I thought was a degree that you undertook in order to become a psychologist, which it is. But what I didn't understand is that psychology also gives you really good research training, and I sort of inadvertently became trained as a behavioural scientist. So I did that.
Did you finish that degree?
Yep. So I finished that degree and did honours in psychology. And then I thought, well, I'm going to become a clinical psychologist because that's what I'm training to do. And that only had an intake every second year, so into the Masters of Clinical Psych. And it's a really tough degree to get into now. Feel sorry for the people coming through now. So I went and did work experience at Cancer Council. I thought, well, I've got a year to fill, so I'll go and be a volunteer or do work experience or something at Cancer Council at Quits. So I'd done my honours project on smoking cessation. I'm not quite sure why, but I guess it was just one of the projects.
It wasn't fate, was it?
I think it was just one of the projects that was available. And yeah, and I wasn't top of the class by any means, so probably I got the project that was left or something like that. So I went off and worked at Cancer Council and worked at Quit for a bit, and that as a volunteer, and that went quite well. And then they sort of created a job for me, which I got as a research and evaluation officer. And then I started meeting people in public health and learning about public health and understanding that public health is about, I guess, using the skills and science from psychology at a whole population level. And so then one of my first mentors, David Hill, who's the person who invented SunSmart and Quit, I think, said, oh, why would you want to go and be a clinical psychologist? You know, you sort of just listen. And he was psychology trained as well. He's like, well, you're just listening to people sort of talk about their problems all day. You're doing the same thing every day, every week, every year. Whereas what we're doing is changing all the time. And I thought, yeah, that speaks to me. So I think my path is in using behavioural science in public health, trying to bring about whole population behaviour change rather than helping individual people.
So was there a eureka moment that was it for clinical psych aspirations?
Yeah, I was like, no, that's right. I don't want to. And the other thing actually probably, I was working on the Quit line as well. So when you're working on the Quit line, I guess you're helping people one-on-one on, I guess, the same issue day in, day out. And that was good and I liked it, but I thought, yeah, maybe that's not the path for me. Maybe the path for me is doing the science around the public education campaigns, those sorts of bigger picture things. So I went and did a Masters in Public Health instead. So that was good. I enjoyed that. I also actually did an economics degree along the way, which sounds a bit odd, but the reason I did that was because I originally was still trying to get into law, and I worked out that I was probably better at maths and economics and getting high grades there than in doing an arts degree and writing English essays. So I'd sort of started an economics degree and then parked it. But the people I worked for at Cancer Council were like, well, an economics degree is a great thing to have. So finish that off, which I did as well as doing my master's. And then I went on and did a PhD and kept working in tobacco control, basically, and became involved in interesting things like a huge National Tobacco Campaign, which Michael Wooldridge set up back in the sort of late 90s, when I was a really young, when I was a graduate. Then I got to get involved in tobacco plain packaging, which was a world first major policy change in the field of tobacco control, and all these really big picture, I guess, interventions, which then led to, small shifts across populations in behaviour, but, in reality, hundreds of thousands of Australians quitting smoking. And I thought, yeah, this is the place for me. It brings social psychology together, with other elements of psychology to a population audience. And when it's done well with a whole group of kind of, passionate, interested, committed people, then you can see the behaviour change and it works. So that's sort of what brought me through to become a public health researcher, I guess.
There was a lot of years and a lot of work with the tobacco control, of course, and a lot of progress.
Yeah.
How does that differ to the current war on vapes in terms of the challenge that it poses?
I think it's sort of all the same thing. It's a different topic. So people think lots of interventions in public health are common sense and are obvious and have always been there. But in reality, they've all been quite hard fought by, a group of people who are really committed to it, working often against commercial or other interests to bring about change. So when I talk to, students in public health, the examples are, work health and safety. So people never used to have any protection. I mean, some people call it the nanny state, and they're the people that oppose the sorts of things that we're doing. But the things we take for granted in our country, like, clean water coming out of our taps and, people being protected when they go to work and not being allowed to drink and drive anymore, which is, a public health example probably from the 70s and 80s, and seatbelt laws, and then tobacco control, lockout laws, all of those sorts of things. Yeah, they're all public health interventions which have a scientific basis that tells us that if we do these things, we know they work from another setting, or they're very likely to work to reduce population health harm. So with smoking, people today would never think it would be normal for us to sit around smoking, for teachers to be smoking in a staff room, for people to be smoking in public service offices.
Aeroplane. That would have been nice.
Yeah. You won't remember it. You're too young. I remember smoking on aeroplanes.
I'm not sure I was on Earth then.
No, you wouldn't be. Yeah, so I remember smoking in offices. I remember smoking on aeroplanes, and everybody thought that was normal, and now no one would think that was normal. So, but behind that, of course, is a very big, very powerful tobacco industry that's made a lot of money out of selling a product which is addictive and unfortunately, kills 1 in 2 long-term users. So that's why we do something about it. Vaping it's turned into a similar phenomena. I think, it was invented, in Silicon Valley or something like that.
They had the Juuls first in America. No one really took notice though until 5 years ago.
Well, what happens is industry come in and buy it up. People see opportunity. They start marketing them in different ways. So what might have started out as an idea around helping people quit smoking who otherwise might be having trouble quitting smoking, in an absence probably of sufficient regulation around nicotine and the delivery mechanism of the nicotine, turned into another thing that kind of gets really out of hand. So you've got a highly addictive drug delivered, packaged in a way that is appealing to young people and seems harmless, and is marketed and delivered on scale, and young people start using nicotine, and, what a surprise, they get addicted, and suddenly we've got a big problem on our hands. So it's the same thing. Like, what does the evidence say? What are we going to do about it? Where do they get the vapes? Putting regulation in place so that, they're flooding the border. Well, let's stop them at the border and give customs the appropriate controls. They're coming in bubblegum flavours and, they look appealing to kids. Okay, well, let's regulate so those things are no longer legal. So a lot of it's it's easy with hindsight and you play catch up, but exactly the same things can be done when you've got good science, agencies that advocate for it, and politicians who are ready to lean into it, which is exactly what's happened in this country. So we've put all these steps in place despite people saying don't do it, especially the people who make money from it, but not always those people, only those people. And then, so now we've seen vaping rates going from, we had vaping rates at 1%, then they were 2%, then they were 4%, then they were 8%. So quadrupling over time. All of these public health initiatives have been put in place. It's not to say they're perfect. They're never perfect. But now we've seen all of those rates drop in half in the space of a year. So
it's pretty strong.
Yeah, it's pretty strong. I mean, we'll keep watching it and make sure it keeps going, and you've got to keep enforcing it and all of those sorts of things. But done properly, public health, it works.
And that ease of access, especially for school-age kids, is a massive part of that equation.
It's huge.
And it's always the way whenever there's something new and there isn't that regulation there's going to be people who manipulate it for a profit until such a time as it becomes too hard to do.
Yeah, that's right. I mean, that's exactly right. So people often talk about the exception or why something won't work or how someone will work around it or how some kid's going to go online because it's still going to be possible for them to download from China. It's not a reason to
just not try.
No, it's not a reason. No, it's not a reason to not try. And it's also, I think, one of the things about public health is there's a difference between what could happen or what ought to happen and what actually is happening. And public health is very much about working in, no matter what the topic, it's very much about working in the reality of what is and helping people understand, including policymakers, what is actually happening. And the reality is you've got a whole bunch of 14-year-olds who think these products are harmless and they can get them off their mate at school, who can get them off their mate, who can get them off someone else, or they're buying them from a convenience store or someone's importing them someone's importing them. There's no doubt about that. But you don't end up with your entire Year 9 class becoming importers of vapes. They just go, oh, okay, it's not easy. And so 95% of them don't use them anymore. Some of them do. We need to put things in place for those people that need help, etc. But, yeah, public health is very much about what actually is occurring, not what do we think is right or wrong. It's kind of an underpinning value, I suppose you'd say, of the discipline.
That's at odds with a lot of what ends up in our zeitgeist at the moment at a time where there's so much misinformation.
Yeah, that's really hard.
How do we separate facts from clickbait?
I don't know. That's very vexed. I think we're in a unique time of transmission of misinformation, and I don't really know what the answer to that is, because I suppose everyone's always worked in their smaller networks of opinion. We take a lot of our information from our social network. That's sort of one of the fundamentals of psychology. Our social norms in Australia, we like to think of ourselves as completely independent, free-thinking individual. We're quite an individualist sort of society, so we see ourselves as very self-determining, but the truth is all of our behaviours are very influenced by the people we hang out with. So what do the people I hang out with do? What do the people I hang out with think is the right thing to do? Like we call those social norms.
Our algorithm and our network, our social network beyond that.
Yeah, that's right. And so previously that network was the people that we knew, the people that we worked with. We also know that, what we see on TV, read in the media, hear on the radio influences our thinking and our social norms in Australia. But now, of course, we're in an environment where the world is smaller and we're accessing information from everywhere. And I guess we're being fed. I mean, I think that's fine. That's great. That's kind of democratic. But algorithms that are feeding us things, particularly if there are commercial interests behind the algorithms that are feeding us things, I think that's tricky. I think it's much easier probably to go down, like at the extreme, it's much easier to go down the weird rabbit holes and hear a whole lot of other people reinforcing.
Especially if they affirm whatever our belief is or make us feel part of a group. And often the weird conspiracy rabbit hole stuff is a lot more fun than the truth.
Yeah, well, we saw a lot of that with COVID and vaccination and all that sort of stuff as well, of course. So it's
Does it
very
get
hard
under
to
your
counter.
skin though when you see people just spreading misinformation sometimes en masse to the public and it's not true, but it's being received as true or people are buying into it?
It doesn't get under my skin. I think it's just part of the reality of how we work. And in public health, I think what we're selling isn't necessarily what people want to buy either.
Can't handle the truth.
Well, I mean, people do sometimes sort of get tied up in knots. I think this is probably true for scientists and academics about what the facts are and what's logical and what people ought to see and believe, and then what ought to be public health, what ought to be public policy as a result. But
that doesn't factor in human behaviour.
Well, it's not everyone's reality and it's not everyone's shared. So it's not everyone's shared understanding and it's not everyone's shared priority. And so I guess I think part of our job in public health is to be good communicators to try to help people see what we see. So, and that's part of what we do in campaigns. So when we did the National Tobacco Campaign back before you were born, we did what we called a doctor's eye view of what happens when you smoke. So that's, I guess, a manifestation of us going, well, we know it's bad and we say it's bad. And when we ask people, they go, yeah, smoking's bad. It gives you lung cancer. And we go, well, why aren't they quitting? Why aren't they quitting? And then you go, well, you can't just tell people something's bad. It's a bit like what we're doing now with food. Like people go, yeah, that's bad and being overweight's bad and eating that's bad. But people know that, but they don't. We have to help people.
It's difficult for us to see compounding interest. Same issue with obesity as with smoking. So if I smoke on one day or I eat a hamburger one day, perspective on that is, so what?
Yeah.
And if you're telling me that, well, the consequences for this are 20 years down the line, it's very hard to take that seriously.
Yeah, that's exactly right. That's exactly right. And it's the trade-off between what happens today versus what happens however many years down the track. And we all, in all our behaviours, are more influenced by what's here and now than what's down the track. So I guess part of our job is to persuade people around that. But then a bigger part of our job is around not trying to change the environment. So it's not, it's not leaning towards everyone smoking, towards everyone vaping, towards everyone eating terribly by default. Yeah.
But then everyone still has to have their own agency and take responsibility too.
Yeah, that's right. And they do. And so it's a balance between those sorts of things.
What drew you to SAHMRI?
I thought I'd been at Cancer Council for a long time. I was probably, I'd progressed up the ranks at Cancer Council and was pretty senior. And probably it was time for something new. And Adelaide's a small place with fewer new things than other places, I guess. And I thought they're setting up a medical research institute. That sounds interesting. I'm sure there'll be lots of really exciting things going on there and lots of really smart people. And I might, see if I can get a job there. Pretty much.
And how's that going?
It's been great. Yeah, it's been great. So I sort of took I came in on a secondment when someone was on maternity leave, and then I sort of took a bit of a leap of faith and thought, well, I'll have a crack at becoming a grant-funded researcher as opposed to being a sort of salaried person the way I was back at Cancer Council, like the organisation.
The much more cushy route.
Yeah, that's right.
Apply for grants.
Yeah, cushy route. That's right. I know. I thought, well, I'll give it a whirl, and I sort of, I kind of cut my ties a bit with Cancer Council, put in my grant application. I thought, oh, what do I do if this doesn't work out?
But I'm just tired of stability.
Yeah, I'm tired of stability. That's right. And yeah, I did get my grant. And so then I was able to build my team and get another grant. And so, yeah, I mean, it is a tough world for researchers kind of living from one grant to the next. And I think it's a shame, really, that, we've got bright scientists all across the country. I mean, I'm not discovering cures for cancer. I'm trying to stop people smoking and vaping so they don't get cancer. But, we've got smart people discovering cures for all of our diseases, and they have to spend a lot of their time fighting really hard to get money. But that's our model. So
also perhaps a bit short-sighted.
Yeah, maybe.
How does leading the Health Policy Centre allow you to make the kind of impact that you've been looking to make?
I work really closely with government. I work really closely with the policymakers who make the decision, and I make a very conscious effort in my work to spend a lot of time being available to ministers or senior government officials, so that I've got a relationship of trust with them and I provide them scientific answers to their questions to help them advance policy because that's their job. My job's to, produce the science, to explain the science, and then it's the policymakers' jobs and the politicians' jobs to sort of make the decisions around what to do. But that's how I make an impact. So we try to do work that advances the field scientifically, but also is very relevant and timely, and also we try to put ourselves in the shoes, or at least stay enough in touch so we understand where the policymaker's coming from. So when we say like policy windows open, so you get a health minister who's interested in preventive health, for example, like we have here in South Australia at the moment, or you've got a federal health minister who wants to do something on vaping. So you've got to be there with your science around the what the problem is, and then you've got to have some science around what the solutions are, and you've got to have a head for what questions are they going to need answers to as well. So it's kind of
SAHMRI's very much looked to for that.
Yeah, SAHMRI is looked to for that, and I think that's because we're fast, we're oriented towards delivering science that's going to make a difference in a short amount of time, and we're responsive. And that's because of the way we've been set up. So partly it's in our organisational structures, but it's also it's a big part of our culture. Yeah.
And that really feels like serving the people, like giving people translatory research that they actually need.
Yeah.
Because I think sometimes science and academics and papers and niche studies can feel like, it's obviously fascinating to some people, but it's kind of in the ether. Like, what does it actually equal?
Yeah.
And Health Policy Centre is like a very direct way of going from research to
end user.
Which must be pretty satisfying, because I know that's what a lot of scientists at SAHMRI want is I want to see my research turn into change.
Something that's, it is. Yeah. I think, we have the papers and need the papers to make sure that the science is as rigorous as it can possibly be. So, and also our system is set up in a way that the scientists are assessed based on the quality of their papers rather than whether or not change has been brought about. And that's starting to shift, but you do have to take time away from it's a trade-off as a scientist. You have to take time away from investing in the high impact journal papers in order to spend time sitting on committees, meeting with meeting with policymakers and politicians.
Because there's a big timeliness factor.
Active choice.
There's a big timeliness factor in governments coming to you or coming to someone saying we need information on this now so that we can make policy decisions.
That's right.
So you're trying to predict the future, I suppose.
You are.
Of course.
Yeah.
But then you've also got to be efficient and quick, because otherwise it's not going to be worth anything if you can't come up with
No, that's right. That's right. It's when it's time to go, it's time to go.
Yeah.
And you have to give them the other thing you have to be able to do is tell them, I mean, they don't want a briefing that goes for 14 pages and has 72 caveats. That doesn't help a health minister about the science, but that's how we're trained to work in science. You have to be able to use your expertise to help distill the science in a way that you can present it to them and they can use, knowing that you're credible and that you can withstand scrutiny and cross-examination.
Well, maybe we have some similarities there. I'm relating to you a bit on that. Give me the summary.
Give me the summary.
Dot points, please.
Spare me the detail. Yeah.
How has your work evolved from research to management? Because you're also our Chief Operating Officer.
Yeah, I've done research and management for a long time. So when I was at Cancer Council, I was General Manager of Cancer Control, which meant that I was responsible for all of our cancer prevention activities and all of our cancer support activities. When I was at Cancer Council, because I had an economics degree, I was also CFO and company secretary there for a short time, filling in for someone else. So I like management and I've always done management. I probably am not bad at keeping a large number of balls in the air, and I'm happy to work at I don't really like the word strategic, but I can't think of another word. Like, I'm not an in the reads person as a manager. So I'm confident in my people. And I think you get on, do your best job. You tell me what you reckon, and I'm going to go with that if I've got faith in you, and I'll take responsibility for the outcomes. So I'm very comfortable working like that. So yeah. And also I think when you're senior in an organisation, it works for me as a scientist as well as an executive, I guess, because you're in different rooms when you're senior in an organisation as well. So you are then meeting with ministers and meeting with heads of departments and whatnot. So it does seem, it might seem sort of discordant, but I think it sort of works. And the other thing I guess I'm doing at SAHMRI is heading up the divisions of the organisation that are enabling the researchers to do their jobs as well. So hopefully that helps kind of provide a bridge, because sometimes there's a misunderstanding on both sides, I think. Yeah.
You get the full picture.
Yeah, and also you can kind of see it from both. You can see issues from both sides as well. So I don't really have an example that I can think of, but I can often think of an issue, how a researcher might come at it, but I also can think of an issue, the way a service provider or an administrator.
Sort of like how lots of our researchers are also clinicians.
Exactly. Great analogy. Yep. Great analogy.
Just thought of that off the top of my head.
How
do you self-manage so that you don't spread yourself too thin? You do spread yourself too thin. How do you prioritise? I know you've got a very, very busy schedule. How do you begin to know what to do first or spend the most time on?
I don't know. Yeah, it's very challenging. Being a researcher is a very challenging, very demanding job that is a 24/7 game to sort of get ahead. So that's a lot. Yeah, I don't know that I've got great answers about how I prioritise.
It just gets done.
Yeah. Most urgent.
Yeah.
Most urgent thing.
Okay. No handy tips there.
Yeah, sorry.
And historically,
I don't think I'm a very good role model for that.
Oh, I disagree. Historically, STEM's been male dominated.
Yes.
And SAHMRI's workforce is over 60% female.
Amazing. Now. I didn't know that.
Oh, you got to check the newsletter.
Yes.
We put it in there.
I do read the newsletter.
And many of our senior management are also women.
Yes.
Why is that important to you?
Look, I think that we want the best brains doing the work, whether they're male or female. And traditionally, science has been very male-dominated for, I'm sure, a whole bunch of cultural reasons about what are acceptable paths for men and women. But I think the other thing that's made science hard for women is, as I said, it is a 24/7 game. And usually it's women who pick up a higher load of caring responsibilities. I do see that changing in the generations below me, younger than me, which is great. So that's, I think, what's made it hard for women to get ahead in science. But I think one of the great things about SAHMRI is it is an environment that recognises that and tries to remove the barriers that we don't need to have in place for women so they can engage more. And I think that's about family-friendly hours. It's about being really flexible, which is a really, integral part of who we are. And we were set up by someone who, with our first director, Steve Wessling, who was not interested in red tape or bureaucracy at all. So he, and obviously you need process, of course, and you need policy, of course, but he had no tolerance for having that stuff for the sake of it if it came at the expense of good researchers getting on and doing their work. So I think our flexible culture is part of what's great. I think we're also a culture which is really welcoming of an international community as well. So, and I think that's because really the most important currency at SAHMRI is ideas and science. So the rest of it's, less important.
There's a lot of ideas.
Not
enough funding.
No, not enough funding. That's right.
Thanks, Caroline.
No worries. Thank you.
If you want to learn more about SAHMRI and the researchers working to build a brighter, healthier future for you and your family, head to samhri.org.au.